Hello, Dr. Arati. Thank you once again for joining me in my next podcast. And having you for the second time is making me more confident. So thank you. Thank you so much for coming in.
Thank you so much, Shravasti. And hello to everyone who will be watching this program. And again, it's a great effort that you have taken to invite me here. This is the second time, and I'm feeling privileged and also like happy to share whatever experience and knowledge that I have. Okay, so thank you once again, Shravasti.
Thank you. Thank you so much. So as promised, we are going to be discussing ADHD today and especially ADHD in children. And I want to start by saying that recently when I have been speaking to children and meeting them in institutions, I've realized that just like today, anxiety and depression has become a very casual word. For everything, they will
Hmm.
be saying, I'm having anxiety, or I am depressed, I am going through depression. Similarly, now children have started also talking about, I have ADHD. Means even if you, the
Yes.
naughtiest kid, if you say, why behaving like this? No, I have ADHD. I have a problem. I have ADHD. So that's becoming
Yes.
a very casual thing. And I feel that more of mental health, crucial issues of mental health have become like people have started taking things very casually these days. So
Yes.
to give them some insight of the seriousness of this particular disorder, I wanted to have this chat with you and understand and make people understand more in details that what is ADHD in a very simple language. If you could like give us some idea about what is ADHD in a very,
Yes.
very simple language.
Sure, Shravasti. So let's understand this with the term means which we identify as ADHD. Okay, attention deficit hyperactivity disorder. So this has two parts. Okay, attention lacking, so attention deficit and hyperactivity. So there are different behavior that is displayed by children. First, like if you look at what is attention deficit, like anybody who has difficulty in paying attention, there will be a lot of things that is happening with them. They will be making careless mistakes. Okay, or they cannot concentrate on things, or if somebody is talking to them, they'll be interrupting or cannot listen or cannot understand the concept. That may be many difficulties that they may face. Okay, like hyperactivity on the other hand will be like they will be more on the go. Okay, always impulsive, like we say it hyperactivity impulsivity. So always taking impulsive decision. They may meet with some accidents means while they are on the go, and make intrudes into others privacy or bust out answer when it's not necessary or they have to wait. So this is like children with attention will be like this, attention deficit, and hyperactivity will be like that. So these are two, and the third comes in, which is like a combination of both attention deficit, hyperactivity. They will have mix of all these symptoms together, and many more.
So why does this happen? Why does this particular problem happen? It's a
So this happens because
neurodegeneration or maybe a neurodevelopmental issue, right?
yes, we call it neurodevelopmental disorders occurring in their developmental ages as they grow from birth till maybe 5 years to 8 years. The neurodevelopment is at the fastest pace, like you can say millions of cell connection within seconds, that fast, which slows down after the 8 years of age. So whatever neurological damage or infections, or you can say any trauma or stress, whatever they had during this time, which is a tremendous speed. Okay, so because of that this disorder happens, like it's a neural disorder, like something damage to our neural system, and it's a growth.
Okay.
Okay, so it's a neurodevelopmental, that is why.
Okay. So like by when we can find out that there is a problem in the child? Means is it a very
uh,
early age problem or like does it happen in the later part of their early age? Means right at childhood,
Identification.
right at babyhood, or
Okay.
like maybe when the child is 5 years, 6 year old, then only we get to know when is the right time to actually understand the child is not okay.
Okay, so first of all, there is no right time for this. As long as, means, if you are more observant of your child, more aware what is ADHD, you
Mm.
will be like aware in the beginning of your child when the child is growing or showing this just symptoms that we discussed, like not able to pay attention, always on the go, tapping their fingers or shaking their legs all the while, cannot listen, or they cannot comprehend what you are saying. In very, like, maybe 3 years, 4 years, parents can be aware and identify this and take them to a screening test, if not diagnostic. Okay.
Can you give me
Have
some
there are
examples of this? Examples of this kind of behavior? Like what would a child do? An ADHD case.
uh, I didn't get that. Like, can you
Yes.
specify what kind of behavior you said?
So, for example, a child who is having ADHD, what kind of behavior does the child show? Like, if you can give me an example.
I would give you an example with one of the child, okay, which we observed. Is that fine? So it's like, we had this child in a school, okay, and there were so many complaints from the school that this child is like creating distraction in the class or disturbing other people, not listening to teacher, or always constantly running on the benches and all those things. So this child we evaluated in the clinic, and we had also given a teacher assessment form which are there screening. Okay, and then for, you can say, naturalistic observation, we had gone to the school. Someday we used to go in the morning during the, you can say, prayers, sometime during the recess, and sometime during the normal classes, and we used to just observe the child without interruption, like without disturbance. So we could see this child was, since his ADHD is like, too much, like during the recesses to just run, push other people. Not that purposely he's a bad child or something, like with other issues, but he's like, it was like so much with lot of energy in the class. He couldn't concentrate. He used to like make pieces, like those chunks of pieces, and throw at the other kids or push them and show that this child is misbehaving. So it is like complaining or talking too much unnecessarily. So this behavior is one of the case I would like to share. Not that all kids will be like this, but
Mhm.
yeah.
I remember once we were talking about this ADHD, you had also said that if you give a child something and say that, okay, now throw it in the dustbin, by the time he
Yeah.
reaches the
Yes.
dustbin, he'll forget that he had to throw it in the
Yes.
dustbin.
Yes. So it is like, uh, they're like, their memory, the processing is less.
Mhm.
Okay, like instruction you give, please
Mhm.
take this thing and throw it out or keep it outside the room.
Mhm.
Okay, they listen to your thing, but it is never processed so well. You
Mhm.
say, no, in memory, it takes time to even retain the information that you have just uh, stored. Okay, so it takes time to actually get fixed in our brain. Similarly, these kids cannot, although they grasp it, they cannot retain it for long. They'll
Mhm.
forget, like take it, they'll pick up the dustbin, they'll move, and they've forgotten like what I have to do with this dustbin. They'll keep it there and come back. So it is like many a times, like this simple things may look like child is very disobedient, is not listening to me. I need to like shout at him, punish him, then he'll be correct. But that will not work. Okay.
So, if I may ask, what will work if this will not work, and
Okay.
what will actually work for, training such children at home, especially for parents? What kind of advice would you give? How does a parent behave in the house, home front with the children?
Okay, so I would just say, like, there is behavior management therapies, which is, I would say, the first hand, that like first thing that you can do. Parents can get trained in behavior management therapy themselves and treat them, or you can say use those techniques on child at home. So they'll be better equipped
Hmm.
what to do when such behaviors occurs, like unexpected, like unhealthy behavior which you don't like in a child. What to say to them. So behavior management therapy, play therapy, um, or other therapies, like you can say supportive therapy, group therapy, like children with ADHD are together to share their issues. Okay, so they understand कि ऐसे normally होता है and what we can do. Like support groups are there. Just
Okay,
like parental support group, ADHD support group also exists some places. So those kind of thing, if they know and put the child for that, that will be great help to the kids as well as to the family and school as well.
correct. As far as ADHD cases, I have noticed that parents themselves, it really weighs them down. It is very difficult to handle a child with ADHD at home because the child is most of the time very restless. So
Yes,
I would also suggest that the parents need to find ways to keep the child engaged, in a very
yes,
positive manner, whether they are putting them into exercises which has cardio involved in it, whether they are going to play sports or instead of sitting somewhere and studying or something. I remember I have a cousin who had the same problem and
okay,
was just not ready to study. He would never sit down to study.
okay,
So instead of putting paper and pen, 1, 2, 3, 4, my uncle, he used to take a football and say, kick. Okay, every time you score a goal, that is the count. So to be
okay,
happy that this person is scoring a goal, they started counting.
okay,
That was he was very young at that time. He just learned how to kick a ball. And that's how he
yes,
learned 1, 2, 3, 4. So there are many such cases. Even there are some celebrities, I can't take the name here, but they have the same
yes,
problem. And they have learned it in very different manners. For example, I won't say that they everybody had this problem, but that was a way out that to learn something, they used to use song, so rhythm.
okay,
So with rhythm, they
okay,
used to learn something because otherwise they would not sit down to learn it. They will not remember. So the rhythm
yes,
helped them
the
to,
rote learning, yes,
yes, yes, to learn something. So that was one thing that I found very interesting when it came to ADHD student children.
yes.
Uh,
So whatever you are saying, it's a part of behavior management techniques.
yes, yes.
Is like
Can you
yes.
give us some more idea about what happens in behavioral management?
So behavior management has different techniques. That it is not just one concept. So it's like you can say there is token economy, rewards, punishment, or you can say other things like you write social stories to them, like how to tie a shoelace or how to behave in a mall. So all these things are read multiple times to the child. Okay, so it get fixed. As I said, processing issues
Okay,
are there,
okay, through
communication. So
repetition. Okay,
everything, yes,
okay,
repetition. You read to the child multiple time, then over the month, this get fixed. How to behave in a mall, how to tie my shoelace, how to wait in a turn. So the social stories, like one like timing out, or you can say sending child to the normal plain room, which is like a sort of a punishment to them. Okay,
oh,
so various techniques are there. Shaping
okay,
techniques are there.
acha,
So
okay.
yeah, around
So
15 types of techniques are there.
okay, okay. So I find it pretty interesting. It's a very interesting way of any which ways training your child. So many a times you
Yes,
really don't have to have ADHD to go for behavioral management. Any kid should take this training. It is very good. I've heard from parents who have taken their children that it has really worked very well with their kids. So yes, this is one thing.
yes.
What other therapies do you have for ADHD?
Uh, with therapies, I would say CBT can be used. Okay, because kids with ADHD tend to have comorbid issues as well. Like for example, many a time it is seen that ADHD also comes with oppositional defiant disorder or
Like,
conduct disorder.
oh,
Yes, conduct, or you can say bipolar, borderline personality issues. It means personality disorders, mood related disorders. They come with that. Even other behavioral things like autism also comes. Like 50 to 70% kids have even autism.
hmm.
Around 10 to 15% had MR. So like various
MR
this
is
kind
like
of a thing.
mental retardation you're
Yes,
talking?
yes, MR is mental retardation or intellectual disability. So you need various therapies like one therapy will not be. Like even their self-concept is down, self-esteem is down, okay, confidence is down. You have to work with like supportive therapy, expressive therapy, or sometimes coaching is needed. Sometimes just talk therapy will be useful. Okay. So various therapies, time, like as per the need of the child, you need to offer.
Okay.
On top of that, I would like to just add all these therapies are there and the therapist, the expert. I would feel the parents are the executive team, should be the executive team member, or you can say the team leader of all the members of the team, the therapist, okay, who is healing the child or trying to treat the child, take the top lead and
Oh,
guide what will be the best for your child. Nobody can do that for you.
okay. Okay. So I feel that parents should be also trained to some extent to understand how to
Okay.
train their children. Okay, fine. I had asked this question earlier also in my previous interview with you, madam, that who should a parent consult first? Means, should the parent consult a
Okay.
counselor, a psychologist, or a psychiatrist? Whom should a parent consult first when they first see signs of such issues in their kid?
So first, I would say the your first doctor, which you go every time. Okay,
Mhm,
the pediatrician, who is like expert to your child.
mhm.
They have whatever, like even the basic medicines, the screening test. They have their ICDs clear, means like international classification of diseases. They know mental disorders as well. So you go to them if you feel that they think that there is some issue or chances are there are some red flags, then they'll send you to the psychologist themselves. If
Oh,
even after diagnosing, like if you get to know that child has severe ADHD with comorbidity, then
mm,
you may have to give them some medicines. You cannot just train with behavior modification. You
mm.
need medicines as well. So both together, medicine plus behavior modification is the gold standard for ADHD.
Okay. So, if I am to understand that for such cases, the first person that a parent goes to is their own counselors. Oh, sorry, own pediatricians. Am I right?
Yes.
Yeah. And the
Yeah,
pediatrician.
regarding the child.
Okay. Okay. Fine. Thank you so much for this. Now coming to the next, that is ADHD. Can it happen to adults, or is it only something that you see in children? Means, for example, if I have never had ADHD, is there a possibility that I can develop ADHD at a later age of my life?
They say that some cases are identified in adulthood, means they were never visible in the childhood. Okay. But since ADHD, we already discussed, is a neurodevelopmental. It comes in when you are growing.
Hmm.
Okay. So now, when you say you have ADHD in adulthood, that could be because of some other issues as well. Okay. Because of
Like,
maybe you have some, you can say bipolar disorders, mania, you must have particularly heard. It's like heightened state of emotionality and activity, just like they are like constantly on the move, thinking to like having too many ideas at the same time. Okay. Or you can say taking risk, meeting with an accident, being impulsive. All these things happens in mania or hypomania as well. Or maybe bipolar you have, or maybe there is some accident or you have some infections in your brain which has triggered that particular area of the brain which get affected in childhood, but the symptom will be more severe if it appears directly in the later
oh my God.
age.
Okay.
That is what I have heard. I've
Uh,
not seen many cases in adulthood, but maybe I would also add, since they are diagnosed, if it is ADHD, they were not properly assessed in the childhood itself, maybe, or their symptoms were not so demanding, like, or the environment was not demanding that they display this hyper or lack of attention skills or something. The environment was conducive and things, and then they had more challenging life. These were more obvious, these behaviors.
so one of the
That is
most
also.
common anxiety disorder that we see is GAD, general anxiety disorder. So do you think
Yes.
somebody who's suffering from general anxiety disorder can also have develop signs of ADHD? Means a person who is continuously anxious. Can that person
Okay.
also have ADHD? Means I have come across such
It
cases.
cannot be developed into ADHD so
Okay.
far as
But will
I
have
know.
similar
I
symptoms, but it will not be exactly ADHD. That's what you're saying.
no, symptoms are also different.
Okay.
Generalized anxiety disorder, you are anxious for every task that is in front of you. Maybe it is exam, maybe it is you're cooking at home, maybe it is like painting something.
Yes, yes.
Everything you'll be anxious whether I'll be able to complete this task or not.
Mm-hmm.
But in ADHD, it is like hyperactivity or lack of attention. There will Anxiety is not necessary. It
Okay.
may be a part because they have low self-esteem and other issues. But anxiety is a mental disorder. This is neurodevelopmental
And that is
disorder.
the difference.
The anxiety is an illness. This is a disorder. So that is a difference. Yes.
Okay. So this is also something that is very informative that ADHD isn't a disease, it is a disorder. So anything
Yes.
that is in disorder can be put in order, ma'am? Can it be cured?
We can try to treat this with our maximum like enthusiasm and our efforts. We can try that. ADHD can be treatable, not cured, but
Okay.
they can be well managed. They can live a normal life just like any other person. It's not a very thing. They have emotional issues or they have behavioral issues. It's not like that.
Okay.
Okay, it's cause of the neuron. So, like as much as you can try to treat, you can.
So when a child grows up, becomes an adult, that person will still have traits of ADHD in them, right? Somebody who is already
Yes,
suffering.
they will have.
Okay.
Yes, but it will be better managed. They can mask it over the period of time, learning from the environment and people.
And do you think there should be regular counseling or therapy sessions with the adults also when they grow up into adult for a long period of time, lifelong?
If they, yes, if they still feel they have difficulties at the workplace or they cannot manage the relationship or they have some complex issues with their whatever they are doing, then I feel anybody, whether it is ADHD or normal, should go to a therapy or counseling. It's a must.
Okay, okay, okay. So one more thing that I wanted to know is that do children have any kind of sleep disorder because of ADHD?
Sleep disorder is can co-occur with ADHD because they are hyper, too much energy. Okay, they feel restless, and when you're constantly thoughts running in your mind, you are restless, it's full of energy.
Mm-hmm.
A child cannot sleep. Okay, so ADHD, this behavior is more persistent. You can say more visible. They will have sleep-related issues with them.
Mm. Okay. So in such cases, we have seen that they are given medicines and
Yes,
to numb them a little, they're given medicines. So yeah,
yes,
I also understand that some type of medicines are pretty habit forming. So at a very small age, if you give your child such kind of medicine, uh,
yes.
do you think you can take them off the medicine or like
If
how?
they are well trained, yeah, if they can manage and mask their behavior, which many people, adults do, there is no need to take medicines. Like also severity will differ. Like they are high, like too severely ADHD or mild, okay, or whether they have other comorbid issues or not. If there is more comorbid, like I remember one child who had ADHD with autism, with intellectual disability, with mutism. So you
Oh my.
can see all the things are clubbed. So no matter how much therapy you give,
Hmm.
whatever you do, the child is not won't be able to cope up that well. So severity also matters. I know one child who is like grown up now and is still cannot talk, and yeah, he is well trained, but it's not that much that it is enough
Okay.
to be independently living in a society. Yes.
Okay. Do you think that these kind of children should go to special schools or can they handle the regular school?
Um, Not everybody need to go. Depending on their severity and comorbidity, they can choose. But normally, child with ADHD can be trained at home, can be sent to normal schooling, okay, where the inclusion is there, okay, and that can be managed, I feel, at home, or there are you can say homeschooling also now, the nowadays concept, so
Mhm.
that can be like used. So yeah, as far as you are doing well with your therapies and everything, medicines, the child no need to send to special school.
Yes,
Just look at like what is needed. Yes.
correct. I understand that. And so I'll just take up one just example. So
Okay.
just wanted to like ask you just before wrapping up, if you can give us some of your cases that you have handled with children who have had ADHD and how they have recovered now or are in a better shape.
Okay, I remembered like some of the cases, like the very beginning of my career with the child with ADHD. And as I said, he had all these multiple issues. So now he's a grown up child, very, you can say almost an adult maybe. And still he have difficulties. But yes, whatever I could do with him, like 2.5 years that time, I'm very satisfied with that. Okay, whatever I could do, teach him basic self-help skill, basic writing, not great deal, just basic writing, and teaching some behavior, like you can say behavior modification, like the hair pulling things and uh, other things. Like he's much better. It's not because of me, of course, but that mother has taken the care, and other therapists. Okay, so I remember this case though. I don't know him right now, but I know once I visited his place. So
Mhm,
that, or many a child, kids I have taught in homeschooling. So there
mhm,
were multiple kids together.
mhm,
So there I have seen, and they are all grown up now.
mhm,
Okay, so they are almost 15, 20 years old children, and they are doing well with the parents' efforts and the therapists that they are taking.
mhm.
Um, yeah, there were many cases I would feel see that I have taken, but recently I'm not taking behavior management therapy that regularly.
Yes.
Yes,
Okay. Okay. So, like I have noticed in my adolescence, as you know, like I'm into adolescent counseling, that
yes,
children, they really, kids with ADHD, given a phone in hand, is like
okay,
it's dangerous. It's dangerous because any which ways you have ADHD, your concentration is least. And above them,
hmm,
you have a phone in your hand which has social media in it. And they're continuously, swiping and swiping and scrolling and scrolling. And every time you're in the classroom, whatever the topic, however interesting the topic is, the child will not be able to sit through the class. So, but like I personally feel and request parents that be very careful about handling your ADHD kids because as far as the no, children who do not have such disorder, they they themselves are facing a lot of challenge when it comes to handling mobile phones. The addiction is so high.
yes,
Maybe I'll do a full set of interviews on this particular topic of mobile addiction. But when it comes to children who are suffering, who have disorders, giving a phone is like giving your Frankenstein in the hand, giving up, uh, a dangerous thing in the hand, and you should not do something like that. Be very careful when it comes to uh, something that will take away the concentration even more. So
okay. So you know these kids better, like with adolescent and all. So
yes,
yes,
this is what I have seen because adolescents, they just can't do without their screen. They will need it. See, to some extent, I agree because they need to study. So many a times nowadays, the study pattern is also changing in children. More, they come to school to bond. They come to school
hmm,
to socialize. But when it is
yes,
about studying something, they would prefer maybe they have a group study, they have a tuition or coaching center, or the best part today is YouTube channels where the good
Yes.
teachers or whoever the teachers they like, they have their own channels, and these children will log into these channels and learn. They will pause, they will repeat, and that's how they try and understand a difficult sum or a physics or chemistry, something that they don't understand, which is very difficult. This is a good place where they can continuously rewind and come back, rewind and come back. So they prefer taking up this through the screen. So we can't take the phone away from them also, but you'll have to be very prudent, very, very careful while handling such cases where you have already the kid is facing a lot of challenges in their development.
Yes.
So
Very
this is it. If there is anything more that my parents have in mind, they want to ask, they have any questions, yes, we are always available through this post. You can find our email address, you can find our website. So please feel free to write to us. Please feel free to write to Dr. Arati, and she will be more than happy to answer you all. And we will come back again with another episode. And thank you so much, Dr. Arati, for joining us once again. Thank you so much.
Thank you, Shravasti, and thank you for the audience who will be watching our videos. On behalf of Beautiful Mind and Soul, I would like to thank you all. Thank you.